All right, so it's about 6:05, so I think it's a good time for us to get started. I'm sure people will come on as we start, but so I'm here today with my partner, Dr. Robert Kelly, and we're the co-founders of the Pennsylvania Pain and Spine Institute. Since the vast majority of you are patients, I'm sure we've seen each other in the hallways and so forth, but currently there's 4 physicians as well as our 4 wonderful PAs in the practice, as you guys have known. And the purpose of today's presentation is to give you guys a good education or perhaps a better understanding of why we have pain and some of the things that we have to offer. And then we're going to go into 3 specific treatment options. Next slide, please. And the presentation itself, we're going to try to be fairly quick and then kind of give you guys some time to do a question and answer session as well. So first about us, we started the practice almost 10 years ago. It's about 9 years, and we've always wanted to have a nice family atmosphere in the practice. We do a lot of things together with our employees as well as with each other outside of practice, work. I first met Rob, when I was much younger at Harvard Medical School, where we were both doing our training. And then Rob somehow convinced me to move to this little place called Chalfont, Pennsylvania. And it's been 9 years and a wonderful 9 years. Next slide, please. And so just a really brief background about us. We're dual board certified in 2 different fields, in physical medicine and rehabilitation, as well as interventional pain medicine. So, how that differentiates us from other pain practices or orthopedic practices is that, we're really trained to try to figure out where someone's pain is really coming from. So trying to get to the root of their problems and then trying to really fix it with now, not just injections and therapy and things like that, but, we've also been trained in these newer, minimally invasive surgical options, that can actually really fix someone's pain condition. So that's really what differentiates our practice from many of the other practices out there. Next slide, please. And so just really fast, the patients often ask me, is chronic pain normal? And, why do we have them? And, for the vast majority of us, our pain really comes from the fact that we're just living much, much longer than our ancestors. And unfortunately, our body is made up of mechanical objects. Our bones, tendons, ligaments, nerves, they age as we age. And so, I've often told this example to patients. If you imagine a brand new car versus a car that's got 100,000, 200,000 miles on it. Well, there's parts that break down, parts that need to be changed and so forth. And so that's really the main reason why most of us have some type of chronic pain as we all get older. Next slide, please. And so on the right here, you see a nice, healthy spine. And again, this is just in the spine itself, but this example applies to essentially any part of our body, our knees, hips, fingers, toes. And so there's predictable age-related changes that happen. Starting in our 30s, the discs start to unfortunately degenerate because it's made of a thick watery gel and water dehydrates. And when that starts to happen, it puts more stress on the joints in our spine, which then causes us to develop osteoarthritis in the joints. And then, there's less space for the nerve. And then when our back hurts, we don't walk properly. So it adds more load to our hips and knees. And so it's a very predictive, cascade of changes that happens as we all get older. Next slide, please. And so traditionally, or even when Rob and I first started, there were not as many options. We either use medications or we sent patients for physical therapy. And then certainly there are injections. And, I'm not here to say that these things don't work, but, I'm here to also say we have a lot of additional options now. Next slide, please. And often when patients didn't respond to, those types of treatments, they would be sent for surgery. And from all the patients that we've treated, there's not many conditions that truly respond to surgery, mainly because we're still using a lot of antiquated instruments and hardware. This is a very typical patient that would have a fusion for low back pain. And if you put hardware in someone's spine or joints and so forth, it certainly can cause them to have additional pain. So our goal is to really give someone the same relief, but through newer methods. Next slide, please. So, what are some of the modern techniques that we're using that no one else is using out there? Well, if we're to determine that your pain is coming from a disc issue, we have the ability now of doing a stem cell injection directly into the disc, which Medicare now covers, where we're taking essentially tissue from a healthy disc and injecting it into a degenerated disc that can take away someone's disc pain. If the pain is coming from the bone due to inflammation of the discs, there's a newer procedure where we can actually go into the bone and cauterize the nerves in the bone itself that takes away the pain forever. Next slide, please. If someone has joint pain, there's different types of radiofrequency ablation procedures, which Dr. Kelly's going to talk about later, and that can be in the back, the knee, the hip. So patients who have quite a bit of arthritis in those areas, that's a wonderful option to help not only delay the need for knee replacements or hip replacements or lumbar surgeries, but also for patients who've had these replacements and still have ongoing pain, it's a great option to help. Next slide, please. And then we have all these newer surgical options that we've been doing quite a bit of, and I'm sure there's patients who are on this webinar who've had some of these things done. Instead of the traditional big back surgeries like laminectomies and fusions, we now offer, the mild procedure, Vertiflex, which can both take away symptoms from spinal stenosis with a procedure that takes less than 15, 20 minutes that has essentially no recovery. For patients who previously may have required a lumbar fusion or an SI joint fusion, that involved all the screws and rods that we saw before, we have newer ways of doing the same procedure, but through small openings in the skin. And so these are also great options for patients as well. Next slide, please. And then lastly, we've always had great results with what's called neuromodulation, where there's implanted devices that either send electrical or chemical signals or directly to the source of the pain. So imagine if you have a pinched nerve, a chronically pinched nerve in your back, instead of we're able to put a small lead into that spot and to block the pain on a permanent basis. And Rob's going to go into this as well. So, our whole point is that there's so many different types of, what we call inline treatments, meaning treatments that can really provide patients with much longer relief than just the traditional injections, therapies, and medications. So now we're going to go into 3 specific treatment options, but of course, this is just our information, and I believe most of you guys know this already. Next slide, please. So now Dr. Kelly's going to go into 3 specific things, so I'll turn it over to him.
Great, thank you, David. You might notice the backdrop here where I'm sitting. I'm actually up in Maine, and the reason I'm up in the New England area is because, as Dr. Q had mentioned, we are very coveted in our approach to pain management, with some of the newer options being offered in the U.S. and in the region. I'm actually up here teaching medical students, medical residents, and attending physicians some of the techniques that we employ in our practice. So I'm at a local medical school up in Portland, Maine, and there's been a lot of interest in some of these newer ideas, and we pride ourselves in some of these inline treatments. Next slide, please. I think the main message here, what I wanted to mention is we really try to find out the root cause of pain in general. And as Dr. Q had mentioned, there are various causes of pain, one being that we have mechanical pain type issues where we have tissue damage, we have achy, throbbing pain, and we have nerve type pain. And I think the next treatment that I wanted to mention really encompasses how we can treat both mechanical and nerve pain, And really it's about beating the pain transmission game. When we can effectively block pain signals and do that in an effective manner where you have long-term pain relief in a minimally invasive inline fashion, I really think that's the name of the game as far as providing more novel, minimally invasive treatment strategies that don't involve major surgery. Next slide, please. One of the things that, as a physiatrist and a physical medicine and rehabilitation expert, that we really look at is getting to know our patients in the sense that how does their pain affect them in their activities of daily living? For instance, we tend to ask our questions in the sense that, why is pain affecting you in the sense that you can't perform things that you like to do, all the way up to older age and younger age? And I think that's a big factor in what sets us apart as a practice. And I think many of you know us already in the sense that we really try to sit down and get to know you in the sense of activity, lifestyle modification, and how we can effectively help with your pain. Next slide, please. Many of you have tried different therapies in the past, including medications, be it over-the-counter or prescription medications, physical therapy, which involves the whole gamut of utilizing modalities like transcutaneous nerve stimulation, which is TENS, and or pain medications. So I think what sets us aside is some of these newer inline treatment options that Dr. Q had mentioned, and really getting to know how your pain affects you in that way and how we can beat it in its transmission signal. Next slide, please. So one of the things that we offer is a radiofrequency ablation, and that is one of our mainstays as far as arthritic type treatments for localized low back pain, neck pain. By the age of 45 to 50, we will all encounter some sort of arthritic type of pain in our spines, and the radiofrequency ablation procedure is one that can really help with localized arthritic type pain as we age. Another option that I'll talk about is spinal cord stimulation. Dr. Q will also elaborate on a newer and novel procedure that we have called the Vertiflex Procedure. Next slide. So let's cover a little bit about radiofrequency ablation. This is a treatment specifically designed for the arthritic type pain in your backs and your necks. A lot of the pain that we experience as we age is related to arthritis. A lot of that pain is referred. For instance, when we have our arthritic facet type pain in our backs, that pain can often manifest in our hips, even our knees. And when we have arthritic type pain in our neck, that pain can manifest not only in the neck, but you can also experience headaches, shoulder pain, and mid-back pain. Next slide, please. I wanted to elaborate, we can go back one slide again. Radiofrequency ablation is a technique that we encompass and utilize, which essentially, as I mentioned, beats the pain transmission signaling. So we have nerves in our back that send pain to those arthritic areas, and we're effectively able to disable a nerve in the back, which supplies the pain to our pain-generating areas, basically eliminating pain by a transmission signal. That radiofrequency ablation procedure has been around a very long time. It's very effective. It's actually a level 1 evidence procedure, and in our world, that's one that has been proven and time tested. When we do this procedure, we eliminate the transmission of pain signals, and patients often get long-term pain relief anywhere from the region of 6 to 2 years. So it's an effective treatment. It's minimally invasive. It's offered in our office in a very sort of timely in and out outpatient basis, and it's something that I think that it can be established as an offering for you in the future if you're dealing with arthritic type pain in the back. Next slide. The next treatment option we have is called spinal cord stimulation. This therapy has been around some time, in the range of 30 to 40 years. However, the advancement in the software technology has really been really evolving over the last 5 years. This is a therapy that involves a device which we utilize to treat pain that's a little bit more involved with not only low back pain, but pain that might radiate down the legs and into the feet. This is an excellent option for patients that have had prior back surgery that are no longer candidates for any future surgical procedures, because oftentimes after back surgery or a neck surgery, having a recurrent surgical procedure can be quite risky and the outcomes can be quite poor from a pain perspective and alleviation perspective. So this is an excellent treatment option for you. It's especially useful for pain in the legs and in the feet, and it specifically has an indication of use for people that are dealing with neuropathy. And there are many causes of neuropathy. Some of the pain from neuropathy can not only come from your back, but from nerve irritation in the legs and the knees and in the feet. And many of you might be familiar with neuropathy coming from diabetes as well. And this is an excellent treatment option for you. Next slide, please. Spinal cord stimulation, as I mentioned, it's been used for over 40 years. It's FDA approved. It's a non-drug therapy. It is covered by most insurance plans, including Medicare, and the technology has dramatically improved in the last 5 to 6 years. And we're very excited about it. I think it's something that we should all be thinking about as far as utilizing more and more. And I think it's an excellent treatment option for you. Next slide, please. How does it work? Well, we utilize spinal cord stimulation therapy utilizing electrical frequencies in the body. And if you think about how pain transmission works, nerves fire signals almost like electrical impulses. You don't feel electrical shocks. However, if we can effectively block those impulses, we can eliminate pain. Next slide, please. I think one of the mainstays and one of the beneficial parts of utilizing spinal cord stimulation therapy is you get to go through a trial process first. So before we utilize the device in an implantation minimally invasive process, we get to utilize the therapy in our office, and you get to go home with that therapy in a more externalized fashion for about a week. It's a nice option because it effectively gives the patients a sense of finding out if the therapy is right for them. And I think that's an excellent thing that we have as far as advanced and minimally invasive techniques, thereby allowing the patient to know fully before they go for an implantation if it's going to be effective and helpful for them in their pain. Next slide. So it can be very personalized therapy. We can utilize it to treat many different pain syndromes, not only in the back, but the extremities, the arms, and then the neck. And like I mentioned, it gives patients an option to trial it before anything permanent is done. Again, a minimally invasive option to treat chronic pain. Next slide. This is some of the supporting data that shows the effectiveness of spinal cord stimulation therapy. It has a long-term, robust reduction in average pain scores, and the therapy, as I mentioned, had been around approximately 40 years. It's stuck. It's an excellent option for patients, and I think it's something that can be incorporated into the genre of minimally invasive pain management. Next slide. It utilizes an application that many of you might have a smartphone, and the therapy integrates through applications and apps on the smartphone. It's very user-friendly, and I think that it's a therapy for the future as well. Next slide. I think I'm going to pass it over to Dr. Q now. He's going to talk about another treatment option that's out there, and we'll go from there. Thank you.
Great. So the last treatment that we're going to talk a little bit about in depth is the Vertiflex procedure. Next slide, please. So Vertiflex is used for the treatment of what's called neurogenic claudication. It just means that due to compression of the nerves in our back, and again, as we all get older, there's less and less space for the nerves in our back. when we stand and walk, it causes us to feel back pain and at times pain going down our leg. But it's typically relieved by bending forwards or sitting down. So I have a lot of patients that tell me, they when they go to the grocery store and they use a shopping cart, they feel better. Or, if they're walking around the block, they need to sit at a bench every so often to relieve their pain. Well, that's essentially from this condition that we all, at some point in our life, will get if we're lucky enough to live long enough. Next slide, please. And so how this works or what causes it is, as I talked about, at the start, there are these predictable changes that happen in our spine due to changes with the discs, arthritis of the joints, and the combination of those things causes there to be just less space for the nerves. The space, or the nerves in our back, it's sort of like a water hose essentially, and we start to develop kinks, and these kinks are made worse when we stand and walk, and relieved when we bend forwards. Next slide. And so how the Vertiflex procedure works is it's done through a very small incision, about an inch or less. And essentially there's space that's created between, where the nerves are pinched. And to keep that space open, a spacer is left there so that when you stand and walk, that nerve cannot be compressed anymore. It's sort of like, the best way that I explain to patients, it's like a very small car jack. It's like a little jack that basically pushes the space open for the nerves. The nice thing is that it's very effective. It's a same day procedure. It takes about 20 minutes. It has very low risk of any complications. And it's been done on 20,000 patients since the FDA approved it about a few years ago. Next slide. And there's some great data behind how it works. There's a 5-year study that's shown pretty dramatic improvements of patients' ability to stand and walk. There's not a single study out there that shows that lumbar fusions or multi-level laminectomies provide anyone with 5 years of relief. In fact, the reason why a lot of these big open surgeries don't work as well is because when you're making a large incision and moving tissue and taking out bone, it creates scar tissue, which then comes back and repinches the nerves. So that's often one reason why a lot of patients don't get much relief. But by making these very small incisions and not doing much with the tissue and bone, we're able to provide that relief we're looking for with these minimally invasive surgical options. Next slide, please. So I think that's really it about some of the specific things we wanted to talk about. You can certainly go on pain.com, and there's more things about the therapies that we talked about. And then I think we're going to open it up for if there's any questions, since there's many of you guys here, and Rob and I are certainly open to answering any specific issues or questions you guys may have about what we talked about or things that we didn't even talk about.
Yes, if there's any questions, please type those in the chat and we'll review.
It looks like people are doing the raise hand icon. I'm not sure. I mean, you guys are much more experts at using Zoom than I am, so.
Hey, Dr. Q.
Yes.
I thought that we might also want to mention that also kind of integrated in our practice are the more traditional therapies. We talked a lot about these advanced procedures that we have, but it's also, I think, imperative that we mention that we do things like acupuncture.
Mm-hmm.
Because a lot of patients are unaware, especially with Medicare, that acupuncture is now covered as a excellent treatment option, and that in the scope of our practice, we offer these, very traditional and minimally invasive options at that level as well.
Yeah, I think I think Medicare has recognized that the need for a more holistic approach. So as Dr. Kelly just said, that they're covering acupuncture now for most chronic pain conditions, and as a result, I believe even some of the commercial insurances have followed suit. So that's certainly a great option to raise or to discuss with our PAs or your physicians when you see them next. There's still a great need for injections for many patients. We're not here to say that everyone should get these treatments, but the nice thing about our practice is that we offer essentially the whole gamut of treatments. From if there is a need for medications, therapy recommendations, injections, and then acupuncture and these additional options.
So Dr. Q and Dr. Kelly, one of the questions listed here is, does any of the new treatments work for AS?
Yeah, I'll actually chime in on that. AS, or Ankylosing Spondylitis, is an autoimmune disorder that we frequently see in our office. And I think when we look at that sort of inflammatory process in the spine, we see the facet joints being one of the primary areas of the lumbar spine, which are the interlocking joints of the back and the sacrum, of which the radiofrequency ablation procedure is an excellent option, long-term relief option for people with AS.
I think just around the question about AS2 is often we see a lot of issues for patients with, that it may involve their SI joint as well, and radiofrequency ablation could be used there as well, and as well as the corner lock procedure, which was in one of our earlier slides, where we can actually go in and lock the joint in so that it doesn't create any more inflammation. So there's certainly advanced treatments that can help with that.
Another question, sorry, was
I'm sorry, Mallory, go ahead.
Was blood thinners having any effect on the stim procedure? I think that's a good general question.
I'll answer that one. When patients are on a blood thinner and we do the trial for the stimulator procedure, most times the patients will come off very briefly from the blood thinner in order to get the trial done, and we can abbreviate the trial process for those patients. Effectively, we have a lot of correspondence with the managing physician who's managing the blood thinner to ensure that there's safe protocols in place. But because we're doing it in such a brief fashion, the trial is very safe, and it's been tested in that regard on patients that have had blood thinners in the past. And then once we go to a more permanent type placement of the stimulator, patients can be on their blood thinners long term, and it has no interacting effect with the spinal cord stimulation therapy.
Another good question here is, my husband is fused from L1 to S1 and still has terrible pain. Would any of these procedures work for him?
So yes, that's certainly one of the leading uses of spinal cord stimulation is for patients who've had a fusion, or especially a significant fusion like that. But I think the most important thing is to really evaluate him and see where his pain is coming from. If it's still from, nerves that are still pinched, whether it's by scar tissue or the post-surgical issues, then I think spinal cord stimulation would definitely work. Sometimes patients who've had extensive fusions also have issues with their SI joint. So I think really figuring that out and then, offering the right inline treatment. But the good news is there are fixes for it.
Could you talk further on the via disc procedure?
I can take this one, and then Rob, if you want to get the next one. So we went over the VIA disc real briefly in my talk. It's essentially it's an approved procedure now by Medicare that's done at the surgery center, and it involves treating patients who have pain coming from a degenerated or an injured disc. So in the old days, people would get fusions, where the surgeon would take out the disc and fuse that segment. But now we can take essentially stem cells as well as portions of a healthy disc from a cadaver and transplant that into the injured disc in the patient. And there's great data on that procedure working. Not only does it help with pain, but it slows down the degeneration of the disc in the future. So I do think there's a great, need and use for it.
Is the mild procedure the same as Vertiflex?
Those are different procedures. The mild procedure, they're both used for lumbar spinal stenosis syndrome. The major caveat is that the mild procedure is a non-device oriented procedure where we clean out the narrowing or the stenotic effect utilizing specialized minimally invasive tools. The Vertiflex, also used for lumbar spinal stenosis, uses a small implant or a small sort of carjacking device, as Dr. Q had mentioned, where we sort of use a lift to elevate the spine. So they're a little different in the format of one being more of a device, the other not being a device, but essentially used for the purpose of the same spinal condition of lumbar stenosis.
Are all of the treatments available to be used in the cervical spine?
So not all the treatments are. Certainly, we hope in the future there will be more and more development of things that can be used there, because there is a difference, obviously, between the neck and the back in terms of our natural anatomy. That being said, spinal cord stimulation can be used there to help block pain there. So again, we can put small cables in the neck to help block chronic pain that's there. We can do radiofrequency ablation of the nerves from arthritis in the neck, and there are other injection options as well.
I'll generalize this a little bit further. I've seen it asked in a couple different ways, but if you've had one of these procedures previously, does it exclude you from getting any other ones going forward?
I guess the response is no in general. It depends on the indication for what we're using the therapy for. For instance, if you're having a condition where you feel a lot of pain down your legs, or a neuropathy or nerve-related pain, essentially, there are certain indications for spinal cord stimulation or Vertiflex, or the mild procedure for that, alleviating that symptomatology. If you have a lot of localized pain, we would utilize a different therapy like radiofrequency ablation. So there is a lot of crossover, but one of these procedures would not exclude you from having either a solitary procedure or a combination of both. And in fact, many patients that we have utilize a combination of both, because as we know, pain sort of comes from different manifestations, not only from nerves, but from mechanical or arthritic type of conditions, and they vary. And that's, again, another reason why we try to get to know truly where the pain's coming from, so we can incorporate the best therapy for you.
What can be done for lumbar pain problems after several trigger points have been performed, also 2 ablations?
So again, I think the important thing is to, certainly with lumbar pain problems, all the, many of the things that we talked about would can be used. The next step would be to figure out what's causing the ongoing issues. Trigger points are typically done for if you have pain due to issues with the muscle or the fascia. So sort of the layer that's closer to our skin. Ablations are done for pain from the joints. One of the difficulties of treating patients with pain as we get older is that often there's multiple things that are happening to cause someone's pain. So while once we treat the issue from the joints, there could be an issue from the disc. There could be spinal stenosis. So really a better exploration, or a better consultation, so that we can determine what the next steps are would be the next step. But certainly there are a lot of options.
Here's another good one. Would like to know if Parkinson's is a contraindication for treatment of chronic arthritis pain in the cervical spine.
I'll take this one. Absolutely not. In fact, many of the treatments that we have promote mobility. And one of the things that we know about Parkinson's is that the longer that we can keep people ambulatory and mobile, the better that they fare in longevity and overall symptom management. So we have many patients that we have that are dealing with Parkinson's disease, and we've utilized many of these different therapies, including spinal cord stimulation therapy, because we know that mobility and ambulation is the key to sort of treating these options for them in the long term.
A lot of good questions here. This one can be, I'll ask it in two parts. Is Vertiflex covered by Medicare? And then on a second level, someone's had a multi-level ACDF and multi-level cervical laminectomy with fusion. Would any of the pain options mentioned help?
Yeah, so the first part, in terms of Vertiflex, yes, it is covered by Medicare. In fact, all the procedures we discussed today are covered by Medicare. And so, that does open up the different options. In terms of patients who've had, laminectomies, multi-level fusions, spinal cord stimulation is a great option. Many patients who've had, laminectomies, what that does is it takes away the piece of bone in the middle of our spine that helps to stabilize things. So that actually puts more wear and tear on the discs and the joints. And so if your pain is coming from the disc, then there's, and then we have two good options for it. If it's coming from the joints, then radiofrequency ablation is a great option. We can even fuse the joint with a little tiny bone graft if there's ongoing issues there. So there's many fixes now that we have for that.
A couple more here. If you could please discuss or maybe elaborate a little bit further on epidural injections.
So epidural injections are one of the mainstays for spinal pain care treatment. Oftentimes, as we had shown in one of the slides, the discs and the nerves are the culprit of pain, and the epidural injection is effectively a minimally invasive spinal injection that we can do in the office. It's very quick, efficient, and easy, that works to eliminate the inflammatory process of an inflamed disc or nerve. That's been our go-to injection for many, many years in the world of pain management. And the nice thing about it is it's very effective immediately. Many patients, depending on the pain condition, do get long-term relief from those. And I think that it's a nice option for patients depending on the pain source and the pain generator.
Finding the origin of pain when everything seems to hurt from the neck to the feet.
Well, that's unfortunately not as uncommon as the patients that we deal with. As we all get older, or for whatever reasons, things that can happen to our nervous system that processes pain. We do have many patients that feel that are suffering with pain throughout their whole body. The procedures and injections that we do are actually very helpful in terms of it helping us with your diagnosis also. Because if we do a certain type of nerve block or we inject a certain area and the pain gets better, then we know your pain is coming from there. Sometimes the physical exam can be helpful, sometimes imaging can be helpful, but really, typically what causes someone's pain, those things are all little pieces of clue that we use to try to figure out where someone's pain is coming from. I keep harping on this, but we do have options to essentially treat pain all over the body. I don't think there's one body part I haven't treated in the last 9 years.
I think a final good question would be two parts. And what training do your PAs have in pain management, and do all the physicians at your practice utilize these procedures?
So the great thing about our PAs is most of them have spent a lot of time with us. Judy and Lauren actually were medical assistants with us. Judy was with us for, I believe, 3 years. And then prior to going to PA school, and then she had done rotations, with us as well, and had a very extensive, training time with us prior to seeing patients independently on their own. And that's the same for across the board. And the other thing is that, they consult with us about every patient. We spend a lot of time at the beginning and end of our days and during our days. If you guys ever accidentally take the wrong exit out, you'll see we all sit in this tiny room and essentially, during the day and go over every patient's case. We all review patients' imaging together. And that way we have a really nice collaborative environments. And there's certainly I think they're many times, even more thorough than we are. So, I'm very glad that we have our PAs that work with us. In terms of, do the physicians all perform these? Yes, we're all trained to do the vast majority of these procedures. Certain ones do more of one versus the other, but we're all happy to offer these treatments to our patients.
I also saw some location or questions in regards to location for the physicians. So we want to put the screen back up for the full contact for Pennsylvania Pain and Spine Institute. So please take a picture, take time. We'll leave this up for a few minutes if you'd like to write down the phone number, the website, any social media, and the address is on there as well. I have a small piece of disc that eats into my spinal column. How would you treat this?
So I think the most important thing is to see, where the disc is and what's the effect of it. If it's causing pinching of the nerves, and the mild and Vertiflex could be used to help decompress or to make space for the nerves there. Often it's too dangerous to take out a small piece of disc. And that procedure in itself can recreate scar tissue that would, essentially pinch that same area. So by doing, Vertiflex or mild, we can indirectly unpinch it. So I think that would be certainly reasonable options. But again, I would have to, or we would have to look at the MRI and things like that.
I have spinal stenosis. What treatment can I get other than spinal cord stimulator? I've had many treatments in your office, but a long time ago. Is there anything new to get rid of pain? Wanted you to know. Okay.
So both the mild and Vertiflex are great options for spinal stenosis. They're essentially, what's called percutaneous or ways of fixing the problem. So instead of traditional open surgery, through a very small incision through the skin, we're able to create space for the nerves. So there are indeed, wonderful new options with, great success. And both treatments do not, burn any bridges, meaning if unfortunately things don't work and someone may need surgical options in the future, that those things can still be done. And there are patients of ours who've had multiple types of treatments, including spinal cord stimulation, as well as Vertiflex or mild, to try to help with those pain conditions. So there's a lot of options. And then I'll just answer the last one real fast, and I think we'll in the talk. Jean asked if the limitations on ablations. So all insurance companies in our area approve of them every 6 months. So essentially 2 times a year for each region. And yes, we are taking new patients. So if you want to give our office a call or our website, you can contact us through there as well. And with that, Joe, if you want to wrap up.
Yes, thank you everyone for your time this evening. Again, please reach out to the office to contact them for a new appointment or to discuss your in-depth individual patient needs and an appointment with your doctor or provider. And the office is accepting new patients. Thank you, everybody. Have a good evening.